Hey, I'm Dr. Emil Tompkins, and in our office, people come in with back pain, but many times people with back pain are dealing with an issue with pelvic balance. We'll notice it in our office when someone lies down on our chiropractic tables, and I'll see that one leg appears to be longer or shorter than the other, where in fact there's not one leg that's longer or shorter than the other, but what we typically see is there's an imbalance in the pelvis that causes one leg to ride up a little higher or lower than the other. And so there are a lot of different reasons for that. Some people will notice that there's a curvature in the spine, and when you have that curvature in the spine, that'll cause some imbalance in the pelvis. For some people who are dealing with trauma can create this pelvic imbalance. If we cross our legs too much, a number of different things can cause that imbalance in the pelvis. So what do you do when you have pelvic imbalance? There are a couple of things that seem to work really well. In our office, there are very specific steps that we'll take. Number one are chiropractic adjustments, where we find out where the pelvis is out of position and we work on moving things back into a more normal position. And when we do that, you'll notice that things are feeling better and functioning better, and we should be able to balance the pelvis that way. But what we also do on top of that is some very specific exercises for the pelvic girdle to be able to stretch muscles that are too tight and strengthen muscles that are too weak. And so I'll explain a couple of exercises that we do or show in our office when someone has a lot of pelvic imbalance. One, the psoas muscle, which connects the lower back to your hips in the front, can be out of balance. One side can be tighter than the other, and that will create some problems. So the first exercise we would recommend is a psoas stretch. So that's the first exercise. If you're lying on a table and you lie on your back, a table or a bed, if you have a high bed, lie on your back and just position yourself so that you're kind of off to the side of the table, and let one of your legs, the leg on the outside, hang, and you'll start to notice that muscle in the front of your leg begin to stretch. That's one way to do it. The other way is to stand just as if you're doing a normal quadriceps stretch, where you put your foot behind you and you hold it there. But if you push your hips forward, that helps to challenge that psoas muscle too. The other exercise we would want to do is strengthen the gluteal muscles. And so the way to do this is with a typical hip bridge, where you're lying on your back, you have your knees bent, and you push your hips into the air, and you hold that position for about 5 seconds. You repeat that exercise 10 times. You do 3 sets of those 10 exercises, and that will strengthen the gluteal muscles. So you want to stretch the psoas muscle, you want to strengthen the gluteal muscles, and when you put those pieces together along with adjustments to balance your pelvis, you will improve your pelvic pain. There you have it, a couple of tips to improve your pain. And if you have any issues or problems with pelvic pain, you should try to balance it with Chiropractic today. I'm Dr. Emil Tompkins, and I hope you have a great day.